Thank you everyone for joining us today. My name is Olga Roback. I am the Colorado State Director of Protect Our Care. Last month, House Speaker Nancy Pelosi and State Democratic Leader Chuck Schumer joined Protect Our Care to kick off the Your Health, Your Vote virtual bus tour to make sure that voters know healthcare is on the ballot this November. This virtual tour is making stops in 16 key 2020 states. We've already had some stops, and there's a few more over the next couple of weeks. And today is our Colorado stop. We're thrilled to have with us a spectacular lineup of healthcare advocates, policy experts, and providers who will share their stories of how the Affordable Care Act has improved the lives of Coloradans. Like I mentioned, we have an incredible lineup with us today. First, I'd like to very quickly introduce our panelists who will speak in a moment. With us today, we have our special guest, Representative Jason Crow, who has been a champion for affordable and accessible healthcare since elected to Congress. We also have with us Penny Potts, a Colorado teacher and cancer survivor. We have Ross Brooks. He is the CEO of Mountain Family Health Centers in Glenwood Springs. And we also have Kristen Urquiza, a national healthcare advocate whose father passed away from COVID. So as I mentioned, healthcare is on the ballot. We are just about 20 some days away from Election Day, and our attacks on the Affordable Care Act have not stopped since it was passed 10 years ago. Trump and his Republican colleagues have taken every opportunity to sabotage our healthcare, pledging to rip away coverage from millions of Americans, including more than 400,000 Coloradans who benefited from Medicaid expansion. They've also doubled down on gutting the funding for Medicaid and Medicare, even in the midst of a pandemic. The Trump administration is now arguing to overturn the Affordable Care Act before the Supreme Court. And if they are successful, the Trump administration would strip away healthcare from 23 million Americans, including 400,000 Coloradans whose protections would end. That would also leave more than 5.8 million Americans who have contracted COVID-19 as folks with pre-existing conditions. But we know here that there is a better way. Democrats in Congress are fighting for lower costs and better healthcare and want to build on the success of the Affordable Care Act. So this is our third tour. This one happens to be virtual, but that's because healthcare continues to be under attack. Today, we are bringing together important Colorado voices to highlight the impact of this administration's failed coronavirus response, Trump's ongoing war on pre-existing conditions, on Medicaid, on Medicare, and his failures to deliver lower costs of prescription drugs. We'll contrast this with the strong leadership we see among House and Senate Democrats like Congressman Crow. Today, the contrast between Trump and his Republican enablers is clear, and we know that the Democrats' healthcare plan couldn't be any more different and better. So this November, we know that your healthcare is on the line. So without further ado, I'd like to pass this on to Congressman Jason Crow, who, like I mentioned, has been fighting for access to high quality and affordable care since he's been elected to Congress. Go ahead, Congressman.
Thank you, Olga, for the introduction and for your leadership for Protect Our Care in Colorado. I actually love seeing everybody's kids participate in these Zooms. I can't tell you how many times I've been doing a Zoom and one of my kids crashes through the door and like shakes my camera or jumps on my lap. But it's really great actually to integrate in some ways our family lives with our work lives. I know it's challenging for us, but at the same time, I think it also might help break down some barriers too. So it's good to see all the kiddos that join these calls. And thank you to Ross and Penny and Kristen for joining as well. I want to be really clear about what it is we're talking about right here. The Affordable Care Act was life-saving and game-changing for tens of millions of Americans. There are 20 million Americans that now have health care that did not before the Affordable Care Act. People that now can get health care that couldn't get it because of pre-existing conditions. Kids that can now stay on their parents' health care. And the elimination of the lifetime caps that would have been devastating for so many families. This is life and death stuff. And then you add on top of it the pandemic. We have 210,000 Americans dead. Over 6 million have contracted the virus. As we deal with the biggest public health crisis we've dealt with in over 102 years, while at the same time we try to get coverage for those 10% of Americans that still don't have it, and the 20% of Americans that don't have adequate coverage. Those are the numbers. That is the challenge in front of us. Instead of joining with us to meet that challenge, instead of joining with me to help pass my Freedom from Price Gouging Act, which would lower the cost of prescription drugs, or my bill to help improve upon, instead of throwing out the Affordable Care Act, what are Republicans and Donald Trump doing? They're trying to overturn the ACA in court. Make no mistake, when Donald Trump says that he wants to improve and have a better system and protect pre-existing conditions, sitting here today, they are in court to overturn those protections. You know, the proof is in what you do and not what you say. That's what's at stake. But more important than any of those numbers, which are more staggering than a lot of people can wrap their brain around, are the people behind the numbers. Because we can toss around numbers like 20 million that have health care that didn't have it, or the 400,000 Coloradans that now have it. But what's so important about events like today are the stories of Ross and Penny and Kristen, because there are real people in real families struggling to survive and to support their families. That's what this is about. So as the Senate today tries to push through, cram through a Supreme Court nominee that will threaten to overturn healthcare for tens of millions of Americans, we're sitting here and coming together today with real solutions, with real people to move our country forward. And I'm honored to be working alongside Protect Our Care and Ross and Penny and Kristen and Olga and so many incredible people to get that work done. So thanks for having me here today.
Thank you so much, Congressman Crow. I think it's so crucial to note that just a week after Election Day, the lawsuit against the Affordable Care Act will be heard in the Supreme Court. And there is a chance that Justice Coney Barrett could be hearing that case. And we already know how she feels about the Affordable Care Act. She's not in favor of it. So thank you so much for working so hard for all of us here in Colorado and across the US to make sure that we have access to the care that we needed when we need it. Next, we will hear from Penny. Penny is a mother and a 5th grade school teacher. And 3 years ago, she was diagnosed with thyroid cancer. She's been battling her cancer and at the same time contending with the weight of the GOP trying to repeal her health care. So without further ado, please go ahead, Penny.
Thank you. And again, thank you so much for organizations like Protect Our Care that allow, our faces to be shown of who is actually being impacted by these choices. So 3 years ago, actually this week, I was preparing for parent-teacher conferences and have a nervous habit of rubbing my neck and found a 3-centimeter tumor in my throat on my thyroid. After a lot of biopsies and work later, it was deemed that my thyroid was cancerous and needed to be removed, thus impacting me for the rest of my life, considering that I need to take daily medication to have my body working for something that I no longer have. Not only was the testing and the surgery and all of the care expensive, but now I am on daily medication that I will be on for the rest of my life. If anyone has thyroid issues, which are a lot of people, you know that it's something that's never stable for long. So one thing that my family and I are constantly contending with is the cost of prescription drugs for the pills that I need to survive. What's been a huge challenge for me is that my levels have not been stable for the 3 years that I've been battling thyroid cancer. And so unfortunately, a medication that might work in a certain dosage for 3 months might change after that. And so having to potentially not only pay for the medication I need every month, but then to potentially have to double up on certain months because my dosage changes makes for an expense that my family didn't have to consider before all of this happened. Cancer wasn't something I chose. The positive to come out of it is that I truly empathize and understand what it means to now be labeled for the rest of my life as a pre-existing condition. But healthcare shouldn't be a luxury. Being a public school educator, the cost of our benefits are increasing every year. One of the ways that they used to tell teachers it's okay that you get paid less is that you have great benefits, and that's just not the case anymore. I know a lot of my colleagues are working to afford medical coverage for their families, and with what we're being paid, that's just, it's a huge sacrifice financially for a lot of families. I also watch what medical coverage or lack thereof can do to my students and families. And this just shouldn't be a luxury item for anybody. We should be entitled to care because we're not choosing these health conditions. They're things that, we rise up and fight against because we want to live amazing lives, but having to battle the financial hardships that come from pre-existing conditions and medical hardships shouldn't be something that families are continuously having to worry about. I feel very lucky in Colorado that there have been great organizations like Rocky Mountain Values and Protect Our Care that are trying to bring Colorado voices to the forefront to hold our elected officials accountable for what they say they're doing. And I think what's been so hard for me with the Trump administration and with Cory Gardner in particular is that you're saying one thing and then doing another and actively fighting against us and the constituents that you're supposed to be serving. I think I was moved to tears during the vice presidential debate when Kamala Harris said, they're coming for you, because I think that hit really hard of anybody who's dealing with anything medically right now. If the ACA is repealed or taken away, it puts millions of people in a position to have to make even harder choices than we're already making. So, I feel lucky that I am healthy and able to fight, knowing that other people are not as lucky as I am. But we have to use our voices to stand up and say that we deserve better and we deserve to have, legislation that protects us for things that, we weren't protected from just because it happened. So thank you so much for giving us the opportunity to speak out today and understand that ordinary Americans are dealing with this every day. So when you're trying to take these things away from us, it's because you've had the privilege of not having to struggle with pre-existing conditions or having family members who have battled, but being in the trenches with people all around me, we need this now more than ever.
Thank you, Penny, so much for bringing that perspective to us. More than 2.4 million Coloradans have pre-existing conditions, and that number has now risen with folks who have been diagnosed with COVID-19. So this is definitely something that at least half of our population is dealing with, and we can't leave those folks behind. And so we're really thrilled to have your voice here and to make sure that your story gets told so that people can really understand what that means especially for folks who take care of our children. We put our children's lives and their education in your hands, and we want to make sure that you are taken care of as well. Next, we will hear from Ross Brooks, who is the CEO of Mountain Family Health Centers out in Glenwood Springs. He is the chief curator and leader of Mountain Family's values, vision, and mission. And that includes overseeing strategic plan and the workforce and operations of many multiple locations out in the high country of Colorado. Go ahead, Ross.
Thanks, Olga. Great to be with all of you. And thanks, Congressman Crow and Penny and Kristen for joining our conversation this afternoon. So I'm Ross. I'm the CEO of Mountain Family Health Centers. I'm also a patient of our organization here in Western Colorado. And we provide access to medical, dental, and behavioral health care for more than 21,000 folks in need in the western part of our state. We live in beautiful Glenwood Springs and serve an area between Vail, Rifle, Aspen, on the beautiful western slope, Garfield, Eagle, and Pitkin counties. It's a gorgeous area, and it also has the unique distinction of being the highest priced health insurance region in the entire country. I remember really well when the Affordable Care Act passed, and prior to the Affordable Care Act, the hundreds of thousands of Coloradans that could not afford health care, much less for pre-existing conditions, but just basic access to primary care and could not afford health insurance. One of the most extraordinary parts of the Affordable Care Act was the expansion of Medicaid across the state of Colorado, helping take our uninsured rate from over 12% down to under 6%. across the state and providing access to hundreds of thousands of folks in our communities with access to affordable health insurance through the Medicaid program. Not only does that cover pre-existing conditions, but it allows folks to be able to access primary medical care, dental care, and behavioral health care as well, which is always important, but is especially acute and important during this global pandemic. I don't know about you, but I've been pretty stressed out over the last 6 months. And so the ability to have access to depression screening and counseling and the behavioral health supports that all of our families need is such an important part of the Medicaid program as well. In addition, Medicaid helps cover those with pre-existing conditions. One of those is my niece, who's got cystic fibrosis and is able to access her life-saving medications and treatments that she needs in having cystic fibrosis. All of that to say, Medicaid makes such a huge difference in not only hundreds of thousands of lives at the state level, but tens of thousands of lives in our local communities as well. And really makes it so that folks can afford the healthcare they need and can afford to live, serve, work, play in our communities. So as I think about potential repeal of the Affordable Care Act and what's at stake before the Supreme Court, in my mind, it's unconscionable to think about that we might repeal access to basic Medicaid services for hundreds of thousands of folks in our communities, for my niece, or for the tens of thousands of folks that rely on Medicaid coverage to get the medical, dental, and behavioral health care they need. Thanks for letting me be a part of today's conversation.
Thank you so much, Ross. One of the figures that has struck me over the past few months is that in 2020, 1 in 3 Coloradans will have enrolled in Medicaid. And that is both as a result of the Medicaid expansion that we've had and as a result of the COVID pandemic. So thank you for talking about how that affects your community specifically. Next, we will hear from Kristen Urquiza, who is from Arizona, now lives in San Francisco, and founded Marked by COVID after the death of her father to coronavirus. She is a graduate of Yale and the UC Berkeley's School of Public Policy, where she has a master's in public affairs. Go ahead, Kristen.
Thanks, Olga. So good to be here with Protect Our Care, Ross, Penny, and Congressman Crow. Thank you so much for being on this really important panel with me today. As Olga mentioned, I co-founded a group called Marked by COVID this summer after the tragic and preventable loss of my dad, an otherwise healthy 65-year-old, to the coronavirus. The reason why I am here and why I've partnered with Protect Our Care to raise the visibility of the need for thinking about and acting to protect our healthcare this election cycle is because we are in the middle of an unprecedented global health crisis. And our current government and administration is not stepping up to the plate. As a result, they are creating the conditions for this virus to thrive. And the cost of that is not just our economic viability, it's people's lives. My dad, he was looking forward to retiring in a few months. He came from a family that traditionally lives in their 90s. He had 20 to 30 more years ahead of him that were cut short. And it's not just people like my dad. This is happening to folks all across the country. And for the folks who are lucky to survive, we still do not know what the long-term health impacts are going to be of this terrible virus. Every single day through my organization, I talk to COVID survivors as well as COVID families. And what I'm hearing from these people is terrifying. The need to remain on oxygen despite being only in their 30s or 40s, months after they came down with the virus, to not being able to worrying about whether or not in a couple of months, if they'll have access to care because they'll be considered having a pre-existing condition. It is our moral obligation to ensure that people are taken care of first and foremost. but it is beyond a moral obligation to ensure that people during a public health crisis have that care as well. So I will close my remarks with just saying thank you so much for being part of this really important conversation, and to not forget that healthcare is on the ballot this election cycle. Thank you, Olga.
Thank you so much, Kristen. We're speaking specifically about Colorado here, but I think your story really resonates with folks all around the nation, and how preventable and unfortunate the death of your father was. So thank you so much for sharing that story with us. So again, this is a live conversation. We are taking questions from our audience. We have now reached our Q&A portion of the call. And so if you are joining us on Zoom, please use the Q&A function to ask your questions, and I will read those out to our participants. If you are joining us on Facebook Live, you can put your questions into the comments section, and I will also read those out to our participants. So the first question that I have coming in is, I think talks to what Kristen was just talking about. So maybe Kristen, if you want to answer this one first. If the Affordable Care Act is eliminated in November, how would Coloradans who contracted COVID or are suffering those long-term health consequences because of the virus, how would they be affected?
It's a great question, and I'm happy to answer what I know and have others jump in as well. If the ACA is eliminated, folks in Colorado, as well as folks all across the country who have contacted COVID, run the risk of being categorized as having a pre-existing condition. Let me repeat, they will have a pre-existing condition on their healthcare record, which will make it much more difficult for these individuals to be able to access the long-term care needed to ensure a full recovery from this pandemic. This is not just the elderly that's impacted by this pandemic. It is people in their teens, 20s, 30s, and 40s. Imagine a person who's just entering into the workforce right out of college, who's rebounding from this disease, not being able to afford healthcare. We cannot play with the coronavirus and our access to long-term care if we want to ensure the state of Colorado can prosper in the long term. So thank you so much for that question, and I'm happy for others to jump in as well.
I'll just add to that, and then I'll have to excuse myself for my next obligation. But in addition to what Kristen said, this is a novel virus. This is the novel coronavirus, and what that means is it's new. We've never seen this disease before, which also means that before December of 2019, we have no data on it. So we literally have no idea what the long-term health effects will be of folks that have contracted this disease. Even people that have contracted the disease and have seemingly recovered, we don't know what the long-term effects are going to be. And there's a difference when you're looking at the data between mortality and morbidity, right? The mortality rates are obviously very high. This is a very dangerous virus, right? This is not the flu. Make no mistake. The president has said this is like the flu. On average, about 20,000 Americans die a year on the flu. And in the last 7 months, 210,000 Americans have died because of this. This is a very different disease. But we don't know the morbidity rates either. And that's going to take a long time to figure that out with data and with research. So we have to be very, very careful here. And that's why we take these precautions and why we need a plan, why we need a federal plan to address this, because our kids and everyone else who are getting these diseases might have to live with the consequences of those. And we have to take that seriously. And with that, I have to excuse myself. I have another obligation at 2:30, but I appreciate the opportunity to participate. And I will reiterate my thanks to Kristen and Penny and Ross for your leadership and lending your voices to the important work here. Thank you.
Thank you, Congressman Crow. We appreciate your time today.
Thanks, Olga.
So again, if you have any questions, please do use the Q&A section of Zoom to put those in, or you can add them to our Facebook live stream comments. I have another question here. I think this one might best be answered by Ross, and then if anyone else has anything to add. The question is, if the Affordable Care Act is eliminated, what will happen to people who enrolled in Medicaid in Colorado as a result of Medicaid expansion under the ACA?
Thanks. That's a great question. So as a reminder, prior to the Affordable Care Act, Medicaid coverage, at least in the state of Colorado, really was for only three groups of folks: homeless individuals, pregnant women, and disabled populations. Those are important populations, but that was a relatively small percentage of the mountain family, excuse me, the Colorado whole. Post Medicaid expansion, we saw Medicaid grow to almost 1.2, 1.3 million people covered in our state under Medicaid expansion. And we took the income level up to 138% of the federal poverty level in Colorado. If the ACA dismantles that Medicaid expansion, it's no less than 400,000 Coloradans who have their Medicaid at risk. And I would argue potentially even more will be at risk of losing their Medicaid or losing federal subsidies for their commercial health insurance coverage. So it's at least 400,000 folks that are at risk of losing their Medicaid coverage, and potentially hundreds of thousands more if the ACA is dismantled.
Thank you. Those are staggering numbers. My next question I have here is for, I think Penny would be best to answer. If the Trump administration repeals the Affordable Care Act, what would Coloradans with pre-existing conditions stand to lose?
I think so many different things. I think about myself right now and being in education, and that, I'm covered through my job, and education is facing a ton of cuts as well, especially here in Colorado. But if I were to lose or have to pay more for my health insurance, you start to have to make choices. I think healthy people sometimes take it for granted of how many little things come up when you are dealing with a variety of different care levels. But, access to my medication, having to do blood draws every 3 months to test my levels, having to go in for, twice a year to check and make sure that I don't have regrowth. All of those things would be things that my family would have to incur rising costs for. And that's just speaking personally. But, again, if more people lose access to care, as Ross was pointing out and Kristen was pointing out, even just these people who are now entering this world as COVID survivors and COVID families, you shouldn't have to make difficult decisions about where your money goes, because those are things that we're not choosing. I obviously have to maintain my physical health before I'm able to do other things, but I want to be around for my son. But there'll be things that my family has to sacrifice in order to pay for my care. And that'll be, debilitating to me. I'm lucky to have a supportive partner who also has insurance. So, but for single parents, for, people who don't have other coverage to rely upon, it's financially devastating. I have a colleague who has been battling lymphoma for the past 12 years, and she's single. And so losing her insurance would completely bankrupt her more than her, medical bills already have over the last 12 years of her life. And that just shouldn't be a choice that anybody has to make.
Thank you, Penny. Those were all the questions that I have coming in. So I just wanted to thank you all again, and thank you to Congressman Crow for joining us today and really talking about how incredibly important the Affordable Care Act is for Coloradans, not just here in the metro area where Penny and I are, but in Ross's County, in throughout our state. And all 64 counties, we have people who live with pre-existing conditions and people who depend on the Affordable Care Act for their access to care, whether it's preventative care, mental health care. All those things have been made possible by the Affordable Care Act. So again, thank you all so much for joining us today and for contributing to this important conversation. We really appreciate you taking the time, and we'll be talking soon.